Welcome to Kitchen Conversations. I'm so glad you're joining me today. And today I have a really special guest and a friend here in my kitchen. So join us as we talk about menopause and hormones. Isn't that a great topic? Isn't that what you've always wanted to know about? Well, that's what we're going to talk today about because I have with me a dear friend, Elaine Hart. She's a physician and a researcher and an educator. And tell us a little bit about yourself.
Hi, Hazel. I'm so happy to be on your program today. I'm an obstetrician and a gynecologist, and I practice at Loma Linda University Medical Center in Loma Linda, California. And I take care of menopausal women and childbearing women and anybody in between, as long as they're female.
So you're taking care of women, and I just understand that you are a specialist in menopausal healthcare.
That's true. I just went through credentialing through the North American Menopause Society, and I have become a menopause specialist.
Well, that's great because that's what we want to talk about today. We want to talk about hormones, about menopause, about aging, and how do we handle what's happening with us and how do we embrace it?
That's a great topic. You know, women spend about a third of their life in menopause, and so it's a very important topic for women and something that a lot of women have a lot of questions about. Should I take hormones? Should I not take hormones? It's very controversial and something that every woman, you know, at some point or another may consider. And so a topic that I would like to discuss with you today.
Well, great. Let's talk about that. So what are the roles of hormones in our body?
Well, estrogen and progesterone are two of the main hormones that are predominant and specific more to women than to men. Some of the other hormones are present with both sexes, but women, especially estrogen, will notice a significant change in the way their body functions if they don't have estrogen anymore. And this is what tends to happen as a woman goes through menopause. They tend to have a declining amount of estrogen present, and they start to, feel different symptoms from this. One of the main symptoms that a woman will complain of are hot flashes. Typical symptoms. They complain of feeling hot all the time, maybe feeling sweaty all the time, waking up at night, having hot flashes at night or night sweats, waking up feeling drenched. Those are some of the common symptoms that women will complain of.
So as we're entering into the perimenopausal state, or that time when our body is getting ready to cease menses, so we're going to get some symptoms happening. So we kind of know that's going on. Besides the sweats and the night feelings and there's some other things. I know I felt anxiety.
There are. A lot of women will have anxiety. They'll feel anxious, maybe irritable, maybe even a little bit of depression. That can also be a common symptom. Some women will complain of having difficulty sleeping, not able to get to sleep, waking up multiple times during the night. That's a common complaint, and probably one of the ones that causes the most havoc in a woman's life. She tends to have a little bit shorter fuse, be a little bit more irritable.
Right.
If you don't get enough sleep, you don't feel well, and you're not able to function through the day. So those are most disrupting, I think, for most women. Some women will also have vaginal dryness. Intercourse can be uncomfortable. Those are also symptoms.
Sometimes there's changes in libido.
Definitely. A decreased libido is a common menopausal complaint. Most women will complain of that at one point or another.
So those things start bothering me, and I just am not sure what's going on with my body. So one of the things that I know in my life, in my health, I do is I go find my healthcare practitioner. So I go see my physician or my nurse practitioner, depending on where I'm living, who I can find. And we start having discussions about hormones, perhaps. So what kind of discussions, if I came to your office, would we have?
Well, what I would find out first of all is what kind of symptoms is the woman having? You know, what's the main thing that's bothering her? Is it the night sweats or the hot flashes, or is it the mood swings, or maybe it's the sleep disturbances? So that's probably most important. Find out, let your doctor know what's bothering you the most and what other symptoms that you have. And then the other thing you want to discuss with your physician is, is there anything that I can do? Is there anything I can do to alleviate the symptoms? And then as a woman, you have to decide, Is it bothering you enough to want to take medication to take care of it, or is it something that you can live with?
Well, I think as a society, we've gotten much more aware of maybe there's some options and some other things I can do. So we want to live fully, we want to live healthfully, and this strange thing is kind of happening to us. And it isn't just happening to us in isolation, it sort of happens to our whole family. That's kind of the tough part, isn't it?
It does. And, you know, your children or your husband may notice changes in you, and they may comment on those. They may not like those.
Yeah, they might think their mother's just a little more crabby than usual. And I think we were talking earlier about the fact that sometimes we might even get headaches.
This is true. Some women, especially as they're going through the perimenopause, they may have more headaches. This is real common.
So we want to take care of ourselves, and we want to start giving some consideration. I know one of the considerations that have been used a lot is, should I take hormones? Should I not? Lots of things in the literature, lots of things in pop culture, in the news magazines. So where do you get good information?
Well, I think the most important thing to do is find a healthcare professional that you are comfortable with and that you can talk to, you can express your concerns, and have an open and honest conversation with the physician and get some good recommendations from them as far as what would benefit you, what are the risks, what's the risk-benefit ratio with taking hormones, because there definitely are some risks with taking hormones, and there's definitely some benefits with taking hormones, and it's a very individual decision that a woman has to make.
So give me some of the benefits. If I'm coming to you, I'm your new patient, and I'm coming to you for the first time, and I have this list of complaints, because we're pretty good at writing the list of everything that's wrong with us. So I'm coming in here and I'm going to go. In fact, I remember, this is really my own personal story. I read a magazine or an article written by a professional that mattered to me, so I felt good about it. And there was a little quiz with 10 things on it. And I took the little quiz and I took it to my personal physician, and I said, look, here's the little quiz I took. There's 10 things on it, and I've checked 8 of them. And she just looked at me and said, sweetie, you are in menopause, and I can help you. So what are some of those things that we've already mentioned some symptoms, but what are some of the discussions we need to have about the benefits of hormones?
All right, well, the main benefit of hormones, I mean, the main reason a woman should go on hormone therapy would to alleviate her symptoms, alleviate those hot flashes, night sweats, mood swings, joint pains, vaginal dryness, whatever symptoms she's having. So that's the main reason. Every once in a while, a physician may put a patient on hormone therapy to protect her bones, to treat osteoporosis or to prevent osteoporosis. But typically it's just to alleviate the symptoms, okay? So that's the reason a woman would go on hormone therapy, and really the only reason that a physician would put them on it. But some of the benefits of hormone therapy, of course, are going to be to alleviate those symptoms that a woman's having.
And sleep again, maybe.
Absolutely. But some of the other benefits that are maybe side benefits are it definitely decreases a woman's risk for osteoporosis. It protects the bones. There is probably nothing better than estrogen to protect the bones. So that's a definite benefit. A lot of women will have fractures, hip fractures, vertebrae fractures that can definitely compromise their health. So protecting the bones is very beneficial to women when in the menopause. So that's one of the benefits. Some of the other benefits are making a woman feel better.
Oh, and that's worth a lot. I don't know about you, but I like feeling good.
Quality of life. That's, you know, in addition to just alleviating all of those symptoms, estrogen oftentimes will make a woman feel better. There's also an added benefit that a lot of women don't know about, decreasing the risk for colon cancer. It actually decreases the risk significantly. Well, it's not a huge number, but it decreases the risk by about 7 women per 10,000 women that are taking hormone replacement therapy. Okay, so that's an added benefit. That's one of the third leading causes of death in women is colon cancer, or at least the third leading cause of cancer death in women. So that's significant. Now, some of the risks with taking hormone replacement therapy, the one that women always ask about and always think about is breast cancer. We're all very concerned about breast cancer. And so women oftentimes will ask about that, or not want to go on hormone therapy, or even go off of hormone therapy if they're on it because they're concerned about breast cancer. So to put it in perspective, the real risk for breast cancer, the added risk, is about 8 women per 10,000 women that are taking hormone replacement therapy.
So
It's very
10,000
small.
women who are actually taking hormone replacement, 8 women.
Will have a new diagnosis of breast cancer. Okay? Now, when you take hormone therapy, we actually call it hormone therapy now, not hormone replacement therapy. And the reason for that is, and I sometimes fall into the old, you know, the trap of calling it hormone replacement therapy, because we've done that for years. We've changed it now to just hormone therapy. And the reason for that is it's not replacement. It doesn't replace the hormones that we used to make when we were in the childbearing years. It's a lot lower dose that we put women on. And that's really important because the lower dose has less danger to it. So it's not replacement therapy, just hormone therapy. So the hormones that we're going to give women are, it's going to be estrogen and progesterone. And it's really important for women to know that if they do have a uterus still, that they have to take progesterone as well.
So if you have a uterus, you need progesterone. But
in addition to the estrogen.
Can use estrogen.
Well, anyone can use progesterone, but if you have a uterus, well, anybody can use either of them. But if the thing to remember for women is that if you do have a uterus, you haven't had a hysterectomy, then what you need to do is take progesterone as well. And a lot of the hormone therapy that physicians prescribe will include both of those. So it's much easier for women to remember. But if it doesn't, some doctors will prescribe estrogen separately from progesterone, and some women don't like maybe the way the progesterone makes them feel, and they think that they can discontinue that, and you can't do that.
Should not,
It can lead to cancer of the uterus, so it could be dangerous.
So you need to protect your uterus with the progesterone. So what are the risks or side effects? What would I want to be concerned about? What do I want to talk to my practitioner about before I decided to do this?
Okay, so the biggest risk with taking estrogen, and estrogen is the one that really benefits the woman, okay? Estrogen is the one that gets rid of those hot flashes and night sweats and makes the vagina more youthful and decreases that vaginal atrophy that causes sex to be uncomfortable. So estrogen is the one that women like, okay? And the big side effect of estrogen, even more than the risk of breast cancer, is actually the risk of strokes or blood clots in the legs or the lungs, and even cardiovascular disease, okay? So estrogen can increase the risk of that. It actually does increase the risk of that. Now, if a woman doesn't have any other risk factors, that may not be a big problem, but women need to be aware of that.
So some of those other risk factors would be high blood pressure?
Not high blood pressure, but it can be high blood pressure. Estrogen can increase blood pressure in some women. Estrogen in birth control pills or in hormone therapy.
Smoking is one of those.
That's definitely a risk factor. So estrogen increases blood clotting. It just inherently does that. So if a woman has underlying increased risk of stroke or cardiovascular disease, that is something that she needs to discuss with her doctor, before she starts, to see if that would, the risk would outweigh the benefits. So that's probably the number one risk, is blood clotting. Number two, for most women, is going to be breast cancer, the increased risk. It's a small increased risk, though. And if you balance it out, the risk, the benefit with decreasing the risk for colon cancer, increasing the risk for breast cancer, it's really only one additional cancer diagnosis per 10,000 women. So it's a very small increase in risk of cancer.
And so if I'm working closely with my physician, then we would be watching for these risk factors as well and be doing some other tests.
Absolutely.
To make sure that we're not
Absolutely.
So what are some of the best kinds of hormone replacements, or not replacements, hormone therapy, I'll get that
That's
right.
okay. It's okay if you call it that.
That I should consider.
Okay, so there's different ways to give the hormones. A woman can take a pill. She can take a pill every day with estrogen and progesterone if she has the uterus. And that's probably for most women the simplest way to do hormone therapy, okay? But it's probably not the best way. Everything I read and study indicates that it's actually better to have topical estrogen and progesterone, which would be a patch or would be a
cream or something that you
You
rub
could
on.
do a cream. That's another way to do it. Those are actually a little bit more beneficial. They have more of a positive ratio on the lipid profile, which would be your cholesterol. Women are very familiar with cholesterol. The pill actually increases some of the triglycerides and things like that, where you don't have that problem if you actually
take the patch.
if you
Put the
use a
patch on.
patch. So patches are really the optimal way to do hormone therapy. However, not all women like the patches. You have to get the patch to stick. You have to change, you change the patch usually every once a week or a couple times a week. So that's one option. Some women like using a cream. They can put a cream or a gel or a spray on their arms. That's another way that women can do it. Now, for a woman who just has vaginal dryness or vaginal atrophy, she may choose to have a vaginal application of the hormone, which
Directly,
is a cream that can be done in a cream or a little pill that goes inside the vagina, or there's something called an E-string, which is a little ring that goes inside the vagina that gives just a little bit of hormone. And if a woman is using that, she doesn't have to have the progesterone. That works just locally on the
Tissue right there.
Yeah, the tissue in the vagina, and you don't have to have the progesterone as well. So if that's the only symptom that a woman is having, that's one way that she could deliver the hormone.
That's a lot of different options that we have.
There's lots of different options that a woman can use.
So if I choose to go on hormones and use hormones, how long would I probably stay on them?
Okay, that's a really good question. And it's very individual. The recommendations are that a woman should not be on hormone therapy for longer than 5 years. Now, if a woman wanted to be on hormone therapy longer than that, she could discuss that with her physician, and if the benefits outweigh the risks, that is something that she could consider if her and her physician agreed on that. But the recommendations are no longer than 5 years. And you probably a woman gets the most benefit from hormone therapy during that initial 5 years right after she transitions into menopause.
Well, it seems logical because your body's had this large amount for a long time, and now it's adjusting to a new way of living and new way of being and so forth. Well, we talked a lot about this hormone therapy and working with your physician, but what other things, as a woman of my age group, perimenopause, menopausal woman, what other things do we want to make sure that we're taking care of in terms of wellness? And I come to you as my physician and what other things am I going to be looking for wellness?
Okay, a lot of women will go primarily to their obstetrician gynecologist just for their well woman exam, usually once a year, annual exam. And what the physician's going to be doing with that exam is they're going to be doing a whole body assessment. They're going to definitely do a breast exam. That's very important to have a clinical breast exam by a healthcare practitioner at least once a year.
Okay.
Women should still do their own breast exam. It's a little controversial, but I still recommend that my patients do it once a month, either the beginning of the month or the day of their birthday every month. But then once a year, get a clinical breast exam by a practitioner. That's very important. They may or may not need a pap smear, but they definitely need a pelvic exam. They need a practitioner, a healthcare practitioner, to examine their uterus if they have a uterus with a bimanual exam, examine their ovaries, check for any masses, and also examine their vaginal health and things like that. And they may need a pap smear as well, depending on the situation. So that's one of the things that a healthcare practitioner will do. Now, they will also order some other tests. tests. One of the tests that they're going to order is a mammogram. Important to have a mammogram starting at age 40. And then
age 40.
Age 40 is
40
the
we
baseline.
start this one. Okay.
And then usually every 1 to 2 years between 40 and 50, and then every 1 year starting at age 50.
Okay.
Now, there have been some new guidelines that have come out lately within the last year, but a lot of us are still recommending the mammogram screening schedule the way I've just described, and that's what I'm continuing to do with my patients. So mammogram is a must. A woman does need to do that.
Okay, so now I'm coming every year. I'm going to have a pelvic exam, going to have a mammogram.
Now, another test that a woman needs to do, once she has reached age 50, her physician should recommend that she have a colonoscopy. And this is not a test that most women are real excited about having.
This is not exciting, but I've done it. I've had
great. Good for
3,
you.
I think. So, yeah.
It's an important test because colon cancer is definitely a risk for women and men as well. Women are a lot better about getting this test than men are.
Boy, isn't that the truth? I just really had to push my husband. It was not easy.
Yes.
And you know, from my perspective, the exam itself was really
It's not
simple.
bad.
The prep is a little challenging, but for me it was just knowing. It was knowing I had to drink a lot of stuff. It was planning my day and making it pleasant for myself. So I set up my bedroom. The family brought a television in for me. I got everything there I needed to drink, and I just sort of hunkered in. That's where I was going to stay for the night.
That's a great way to do it.
And it worked out.
It is. It's a very important test, and a woman should have that at age 50, typically every 5 to 10 years. Most women every 10 years after that. So 50 and then 60, unless your healthcare practitioner tells you to do something different. So it's not the most pleasant test, and the preparation for it is worse than the test.
Absolutely.
But it's life-saving. It can be life-saving.
And the test, my practitioners, they were just so nice. And when I got in there, I just felt comfortable. I felt secure. I felt covered, which I think people who don't know what we do in a hospital worry about.
Absolutely.
I was very well cared for.
Great.
Okay, so now we're going to have those 3 tests.
Okay, so we're going to get some lab tests too on you. Okay.
Blood drawn.
A little bit of blood. There's almost always some blood that's going to have to get drawn. So what we're going to recommend for your age group for a menopausal woman is going to be a thyroid test. Thyroid is very important to test on a woman. Thyroid disease, especially low thyroid, is very common in women. So we're always going to recommend a thyroid stimulating hormone test. It's a blood test that we do.
So if I'm low on thyroid, what kind of symptoms might I be experiencing?
A woman that's low on thyroid might feel fatigued. She might be tired all the time, have lack of energy. It may even have some depression. If she's still in the perimenopausal years, oftentimes that will increase her bleeding. She'll have heavy periods, abnormal periods.
Okay.
That's another common side effect. She may feel cold all the time. That's a common symptom as well. So we always test for thyroid by testing a thyroid stimulating hormone. Another test that we want to do is check fasting blood glucose. We're looking for diabetes. Okay, that's another important test. And then we're going to check a fasting lipid profile. And this is a cholesterol check, basically. And we do the whole panel of cholesterol, looking for the good cholesterol, which is the HDL, and the bad cholesterol, the LDL, and the total cholesterol and the triglycerides. And then we also look at something called a ratio, which tells a woman her risk for heart disease based on her cholesterol. So that's another test that we will do. Again, it's a fasting test.
Oh, good. So anything else that I need to be thinking about in my annual aggregate of taking care of myself?
Okay. What we would also recommend for a woman is that she takes a multivitamin every day. A multivitamin, most of us unfortunately do not eat right. I wish I could say that we all did, but we don't. And so we do recommend that a woman take a multivitamin. If a woman's younger, a prenatal vitamin every day is a good thing if she's in the childbearing years. But for a menopausal woman, just a multivitamin is good. And then calcium, also very important, with vitamin D in it.
With vitamin D.
With
I've been
vitamin
hearing
D.
so much about vitamin D. Is it the magic drug or something?
It's one of the magic drugs right now, and we're really seeing the benefits of vitamin D. And so a woman should definitely have vitamin D with her calcium tablet. She should take a total of 1,500 milligrams a day of calcium. That's very important.
Okay.
Now, if with vitamin D in it. Now, if a woman is age 65, routinely we will order a bone density scan for her. We're looking for osteopenia, which is bone loss, or osteoporosis, which is significant bone loss. So we would recommend that. If a woman has additional risk factors, her healthcare provider may recommend that she have that at an earlier age.
Okay.
Say, for example, she has some sort of thyroid condition, or if she has a parathyroid condition, or if she has been on steroid drugs for any length of time, or has had any previous fracture or any other health conditions, they may recommend that she have that at an earlier age. It's important to protect our bones. And the way that we can protect them is making sure that we don't have any bone loss, and then taking medication if we need to, and getting regular exercise, very important as well, weight-bearing exercises. And that doesn't necessarily mean walking around carrying weights, but just standing on your feet, standing up, walking around. That's considered walking, upright is considered weight-bearing exercises. So women should make sure that they do that for their bone health and just for general health. Overall, they should be exercising.
Well, I really appreciate all these tips that you've given us today. It lets me know that there's a lot of things we can do to enhance our health, to make sure that we're living these last 30 of our life, 30 years, whatever that is, whatever our days on this planet are, but abundantly and full of energy and enjoying them. And if I see my physician regularly, and if I follow through and have my exams and know that I'm doing good, there should be no reason that I shouldn't just enjoy the life that I've been giving.
Absolutely.
And pull that joy out of the inside of my life, knowing this is natural, this is normal, this is what I'm supposed to be going through and living. This is not a disease.
It's not a disease.
Like
it's a
that.
normal process. And it can be handled as necessary. If a woman needs help with menopause and she chooses to do hormone therapy, she can have a great life. Quality of life is very, very important for women, for anybody. But when a woman comes to me, I want to work with her and make sure that her quality of life is good.
Well, I think we've learned a lot here today in my kitchen. I hope you've learned as much as I've learned. And I have enjoyed knowing what I need to know to keep my health strong and good. That as I go through menopause, there are some choices. There's some options that I have. I need to just work with my physician. And there is a website that I can check out if someone in my area is specialized in menopause.
There is. A woman can go on the internet and just look up the North American Menopause Society, and they can put in their zip code and they can find a certified menopause practitioner who can help them and guide them through this process.
Isn't that great news? Well, until I see you again in my kitchen, you stay well, be happy, embrace the abundance that life has for you.